The relationship between urinary tract infection, renal scarring, and renal damage and renal failure is central to giving the continuous antibiotic prophylaxis in recurrent urinary tract infection. The changing concepts in this, we will look in this video, the changing concept regarding this relationship. The concept in 1970s was that vesico-ureteric reflex causes pyelonephritis and renal scarring, and this leads on to renal damage and renal failure. Therefore, children were routinely subjected to voiding cystourethrogram or VCUG to detect and grade vesico-ureteric reflex. They were treated with antibiotics for the UTI and subsequently almost routinely put on continuous antibiotic prophylaxis, and sometimes even surgical correction was done. The present concept is there are two groups of children. The first is the low-grade VUR, which is also called as a non-dilating vesico-ureteric reflex, and they have no or minimal kidney scarring at the time of diagnosis, and only 5 to 30% of these children go on to develop a second UTI, and small percentage of that develop permanent scarring, and continuous antibiotic prophylaxis has got little or no benefit in these patients. The second group of children, which represents the minority with the first UTI, consists of those with a high grade VUR, which is grade 4 and 5. This is a group which has not been studied extensively, and they usually have extensive kidney scarring at baseline and a predisposition to multiple breakthrough UTIs. There's not much literature regarding this group of patients. These children are at the highest risk of suffering clinically significant renal injury. Considerable uncertainty exists about the management of these children, and it is not very certain whether continuous antibiotic prophylaxis prevents long-term renal insufficiency. Some of these children have genetically determined developmental abnormalities of the kidney and urinary tract, which manifest after birth as VUR and renal dysplasia and hypoplasia, especially in grade 4 and grade 5 reflex. In these UTIs are an epiphenomenon rather than the cause of the renal abnormalities. Therefore, it's a question of whether the chicken comes first or the egg comes first. Now they are turning the theory on its head. Previous concept was that urinary tract infection leads on to renal scars and renal abnormalities. Now it's the other way around. The abnormal renal dysgenesis leads on to recurrent urinary tract infection. And therefore, the surgical correction of VUR may remove an important risk factor for recurrence, and prevent subsequent kidney injury. May. What it shows is that it may or may not. And this is a very difficult, this is the problem here, which is not resolved. To make sure that the plot is not lost among the muddle of information I have given you, let it be clear. In summary, most of the recent reviews show that the conventional assertion that VUR predisposed to UTI, acute pyelonephritis, and renal damage are not supported by the current data. So now, in contrast to earlier studies, which showed that pyelonephritis was the only reason for renal damage, intrinsic renal disease is now thought to be also contributing to chronic renal disease in children. This has been shown adequately by antenatal ultrasonographic studies as well as population-based studies.